Good afternoon, everybody. Today is Friday, May 8th, and this is our weekly update from the Health Department about COVID-19 here in Falmouth, focusing mostly on Falmouth and Massachusetts in general. Our website is falmouthmass.us. We update our website frequently to try to give you as much information and links to all the good information that you need. If you need to email us at health@falmouthma.gov is our email address, and our phone number is 508-495-7485. Just to let you know, there may be a little bit of delay in responding, but we will do our best to get back to you. Additionally, if you're complaining or if you have an issue with something, maybe we've seen it a bunch of times and we're on it or something of that nature. So maybe, just give us a little bit of a chance and we'll get back to you. But that's our contact information if you'd like to contact us. So our update for today, there's about 139 to 140 cases, so right around 140 cases since March 1st. I like to try to put some good information because we generally get bad information, is that all over 90% of the cases have recovered and are out of isolation. So, people do get better, and so cases from March and early April, they're out of isolation. So, another slide that we'll have further down will better indicate what's going on. So the VNA, again, with the support of the Health Department, we keep performing isolation and contact tracing on each case. As soon as they come to my email, we jump on it. Usually the VNA is already on it and doing the interview, so it's really good. Falmouth is about 14% of the Cape's population, and we're around 14% of all cases. And again, I've said in previous ones that we started hot at 23%. Unfortunately, one of the reasons is because a couple of different nursing, long-term care facilities, one in Brewster and one in Harwich, over the last couple of weeks have had a lot of cases. We do have some cases in those facilities here in Falmouth. They have not, and hopefully continue not to elevate to that kind of level. So we're right around what we should be expecting for cases, around 14%. Our weekly case trend, I update this every week. We've pretty much been staying right around 8 or 9 to 12, 13 per week. Excuse me. So essentially, we have been staying, between 8 and 12, and that's a pretty good pace. We've sort of leveled out. You can see since about mid-April, and hopefully we can continue with it. And it's encouraging that it's been 4 weeks now with about the same average number of cases. The newer cases have been more towards assisted living. We've had a few this week, and less more at sort of the ones at someone's home. So, which obviously I'd prefer not to have them at a nursing facility, but that's kind of where we've been the last week. Here's our case trend that we update every week. This is just total number of cases, not taking any off. Total number of cases, obviously this will continue to increase if we have, as they go, but we can see that we have tailed off as of recently. Down below you can see active cases. We have less than 20. Active ones that we're aware of, again, this does not count any not asymptomatic and people that haven't been tested, but of the tested cases, there's currently just a little under 20 that are active, or less than 20 that are active. Cases, that they're not out of isolation. So the vast majority of people have made it out of isolation, as I mentioned before. From the state's dashboard, this is yesterday's data, 1,696 new cases. That's still, on the high side. We're still getting a lot of cases statewide. We're about 5% hospitalization. That number is definitely down from earlier in the month. That was more like 8, and that's got a lot to do with testing more and more people that are less and less sick. And I'll show you that in a second. Confirmed deaths are 4,552, with about 60% coming from, long-term care facilities, unfortunately. And for the day, it was 132 deaths. This is the testing done. The first chart shows you the number of tests done by day. Obviously, you want to have more and more tests. I'd like to get that number up. The more tests that we do, the better. And down below, you see that the rate at which they're coming back positive. The state wants that number to be under 10% consistently as part of the reopening process. As you can see, we had a spike up earlier in the week to 28%, but it's been hovering around the low teens now since for the last 10, 12 days or so. So the state wants that under 10% and wants that number to, the number of tests to go up, and hopefully those trends continue. And you can check this every day at the dashboard that the state puts out. And usually it's sometime between 4 and 5 in the afternoon that they'll update this. Again, Barnstable, Franklin, Hampshire, and Berkshire counties are doing better than the other counties, and this has been a slide I've put on. This one's the 23rd. I actually meant to update it, but today's it looks exactly the same. Barnstable County and Plymouth counties, again, I've been showing that to show you the difference. With Barnstable County being the orange, you can see that sort of, their numbers are sitting pretty consistent. You see Plymouth County in gray, which shows you that they're still increasing. And that Falmouth in blue is sort of leveled off. And so that's good, obviously, and we'd like to continue that trend and start working our way downward. State, county, and local cases per population, okay, per 100,000. The state has gone up about 100 per 100,000. The county's gone up about 64 per 100,000, mainly because of those two long-term care facilities. Falmouth has been pretty strong, that we're only gone up about 20, 25 points. So we're doing better than the state, and right now doing better than the county, and let's just hope that continues. One of the other things that the state looks at is sort of our reopening is hospitalizations going down, and you can see I circled a definite trend of our daily hospitalization cases going down on a downward trend. So it looks like yesterday we were down 126 hospitalizations, and again, that's another good sign. Barnstable County does a daily website update, and one of the things that they showed is the hospitalizations. You can see that on 5/6/20, that Cape Cod Hospital has 24 beds occupied, Falmouth Hospital has 5, and you can see the previous times it's been 27 and 19 back on the 21st of April, and then worked its way, and we're in fairly good shape. Again, the uptick at Cape Cod Hospital would be attributed, I think, probably most likely to those two facilities. Barnstable's total number of confirmed cases is 997, and the deaths in Barnstable County confirmed are 55. Again, testing is still the same. It's Monday through Saturday at 4 Cs. Your physician will determine the need, and you can schedule that. It gets scheduled, and your results come within several days, and so that testing continues. Okay. There's been a lot with antibody tests. Antibody tests the whole thing about antibody tests, I think, is the FDA isn't really cleared a lot of these test kits, and so that's sort of a pending thing that we really need to figure out quick, because we like to be able to do that and do that accurately. Face coverings, if you, like last week I had mentioned that the Board of Health voted on April 27th to require face coverings of employees and the public when indoors, and while in facilities that are still operating. Back on the 1st, Governor Baker issued a similar order beginning on 5/6, which was this Wednesday, for indoor and outdoor places when social distancing is not, indoor places and outdoor places when social distancing is not possible. It's obviously most important when social distancing is difficult and when you're indoors. So I have actually, we got a lot of calls up until probably the last few days from residents talking about people that are not wearing them. So I guess that could be an indicator that we've been more compliant with it. I'm not sure, but we've definitely had less calls at the health department regarding face masks. Personally, as I've been around, I've been seeing them. So that will continue, and that's part of our reopening strategy is social distancing and facial coverings. So they're both still as important as ever and will be part of the reopening process, which, if you look at the last bullet point, on 5/18, Governor Baker's to hear from an advisory board regarding, strategies for reopening. And, we plan to take the governor's strategy and roll with it. And so I don't have any information of what's going to happen after the 18th, but we'll definitely let everybody know as that advisory board reports to the governor and the governor makes his decision. Again, being aware of your health and staying home when ill is also a very important thing. Nobody needs to be a hero and try to work with that cough or that fever. Hand washing, hand sanitizing, cleaning of common surfaces, also important. If you get called for isolation or quarantine, take it very seriously, fast to do so. That's a very important thing. Again, the data is what's going to drive our ability to reopen and return to some sort of normal. And as information comes to us at the health department, I share it with the chiefs and the town manager and the departments that it may affect, and we go from there. Just recently, yesterday, they opened up golf courses, the governor did. So the golf courses are aware there's some social distancing requirements, no indoor, no going indoors, certain things about the ball washes and the drink dispensers and not having those, and certain things like that. So, you know, you'll start seeing that stuff roll out. I'm personally working with some of with other health agents to work on procedures for restaurants when that eventually happens. So we're all working hard to try to make sure that we can do this as safely as possible. So again, just to recap, that Falmouth is doing well and has been doing well for several weeks, and let's hope we maintain that. And again, if you have any questions, feel free to reach out to the health department. Thanks.